Hello everyone, I am Yashwant Singh here. Today we will know about bones of upper limb. Upper limb comprises of following bones: the clavicle, which is also known as the collarbone and can be palpated from outside; the scapula, which is a triangular bone which help in the formation of shoulder joint. Then comes the humerus. It is one of the biggest bone in human body. It is very strong and is bone of the upper arm. Then comes the radius and ulna. The radius is found on the lateral side. The ulna is found on the medial side. They both are found on the forearm. Then comes the carpals. There are small cubical bones known as carpals. Then there are metacarpals. And then there are phalanges. There are 3 phalanges in our 4 fingers and 2 phalanges in our thumb. The bones of the upper arm help in articulation of muscles, which then help in the movement of the body or the upper arm. So now we will study each bone one by one. First of all, we will start with scapula. It is also known as blade bone. It has 3 borders: upper border, medial border and lateral border. 3 angles: superior angle, lateral angle, inferior angle. The borders are superior border, medial border and the lateral border. It also has 2 surfaces: anterior surface and posterior surface. This is the posterior surface. It is filled with structures while the anterior surface is fairly plain. The posterior surface faces the skin of the back while the anterior surface faces the ribs. The posterior surface have various structures like acromion, spine, suprascapular notch. It is a notch present on the superior margin. Then comes supraspinous fossa. Supraspinous means above the spine. Infraspinous fossa. Infraspinous means below the spine. The spine is a upliftment, or you can say is an extension which is found on the scapula. Now we will learn about the anterior surface. As I already told you, the anterior surface is fairly plain and consists of only one main structure, that is subscapular fossa, which is this dentation shown here. As we all know, there is one very important angle in the scapula, that is the lateral angle, as it is the place where humerus articulates with scapula to form the shoulder joint. It also has various important structures which we will learn now. So the structures of lateral angle are glenoid cavity. Glenoid cavity is a dentation or a cavity, or you can say a concave dentement in the scapula where the humerus forms articulation with. Here the ball and socket joint is formed. It also contains supraglenoid tubercle. Tubercle is a swelling which is found on a body. Supraglenoid means above the glenoid cavity, that is here. It also contains infraglenoid tubercle. Infraglenoid again means below the glenoid cavity, that is here, this swelling. Then it consists of Caracoid process. Caracoid process is this process coming out of the scapula. All these structures help in articulation of scapula with the humerus. This joint is very important and do flexion, rotation, extension. The joint found here is ball and socket joint. So now we will study about the necks of the scapula. Scapula consists of 2 necks: surgical neck and anatomical neck. Surgical neck is a place or a structure where most of the fractures occur, that is this line. Most of the scapulary fracture occur at this place, while the anatomical neck is present here. What a very important question, that is the correct anatomical positions. This question is being fairly asked in the Vivas and is often very hard to answer if you don't know the correct way. So to correctly do it, first you need to differentiate between the anterior and the posterior surface. The posterior surface contains a spine, which makes this difference fairly obvious and easy. When you look at the spine, you will get to know that it is only present on the posterior surface, and you will find which is the anterior and the posterior surface. Now let's find the lateral angle, because these two are the marks which we will use to determine the correct anatomical position of our scapula. The lateral angle is the structure which contains the glenoid fossa or the glenoid cavity. When you look at the glenoid cavity, you just have to put it at a right angle, at a perpendicular from the ground. Then the spine should go behind. As you do it, you will find your scapula on the correct anatomical position. So now we will talk about clavicle. Clavicle is also known as collarbone. It is a S-shaped bone. It is present between the breastbone, as seen here, and scapula. This is the acromion process of scapula on which the clavicle or the collarbone articulates. On the sternum, it articulates with the manubrium. So, as I already told you, this bone is S-shaped, have two ends, sternal end and the acromial end. It can also consist of a middle shaft, this portion. It have two surfaces, inferior surface, superior surface. The superior surface is fairly blank, while the inferior surface consists of many structures. This is the inferior surface, you can see over here. These are the important structures of the inferior surface. Now, talking about its end, the sternal end is expanded and bears an articular surface for manubrium of sternum. It is also roundish to quadrilateral in shape. So, here you can see this is the sternal end. Here you can see it is roundish and it articulates with manubrium as shown here. Now let's talk about the acromial end. The acromial end is fairly flattened as seen here and articulates with acromion process of scapula. Now we will talk about the shaft of the clavicle. The shaft of the clavicle is the middle portion. Now one important thing to remember, on the sternal end it is curved towards the front. So this is the sternal end as seen here and it is curved towards the outside. It is like this. This is the acromial end, this is the sternal end. Here it is towards the front, here it is towards the back. So on the acromial end it is curved toward the back. One more important thing to remember is the structures of the shaft. One of the most important structure is impression for costoclavicular ligament. This. It also consists of groove of subclavius muscle here, conoid tubercle and trapezoid line. On the sternal end, sternal articular surface is found, while on the acromial end, acromial facet can be found. As I already told you, its superior surface is fairly blank as seen here and do not contain any important structures in it. So now we will learn about the correct anatomical position of clavicle or the collarbone. To do this, first we will differentiate between the superior and inferior surface. The inferior surface is filled with cavities and tubercles, but the superior surface is fairly plain. So this can be done very easily. When you have found the difference between the superior and the inferior surface, as seen here, the inferior surface have this tubercle or outside growth. Once you do this, you just have to find the difference between the lateral and the medial end. This is also fairly easy as the lateral end is very flattened as seen here, as seen on this side, and the medial end is cubical to circular in shape. So once you find both the differences, you can correlate them and find the position of your clavicle. This is the most easy way to find the correct anatomical positions. There are various other techniques that can be used, but I find these to be most effective. So that's all for today, guys. Don't forget to subscribe and leave a like.